just seeing the disease burden that kind of affected our healthcare system and resulted in morbidity and mortality, especially during that period of time. You really notice that obesity, diabetes, heart disease, and these chronic diseases were the patients that didn't do well. And I was like, I just had wished at that point that we had been a little bit ahead of the curve, kind of with more of a preventative focus on these patients and maybe preventing the disease of, obesity, the epidemic that we have in the country that's caused so much issue. And that's kind of what sparked my interest in longevity-based medicine and anti-aging. And then I always saw men's health as kind of an underserved area that, you know, especially with the boom in aesthetics that kind of affected, women's health. And
Yeah.
you had just this explosion of med spas on every corner. And I'm like, well, what about us? What about the guys?
What about the guys? Where are we at? Where do we fit into this?
I hadn't seen too many, clinics or
There's still not.
approaches for men,
Yeah.
right? And somewhere a man can go and feel comfortable going there, because I think there's always a stigma a lot of times for men is that I don't want to go to the doctor. Men are actually much more likely to not go to the physician, and also our health span is is shorter than women, and I think
Mhm.
that's part of the reason why.
Right.
And especially when it comes to men's health, you think of things like sexual function, libido, things that like give a man a mojo. And so you have this stigma of, if something's happening with that realm of your life and your testosterone is going down, you start to think of it as like you might be losing your edge, your mojo, what makes you a man, right? And so not being able to want to seek help in that area
Right.
is what I saw a lot of. And so you need someone, that's not just like doesn't feel like just a doctor, but actually like a friend, like a homie, someone you build a relationship where somebody can tell me, oh, me and my wife aren't doing good this month. I need you to look at my like different levels, or I need somebody to help me focus on getting my performance back in the gym, or I'm not doing as good at work anymore because of, I think maybe my testosterone is going lower. But these are things that when you take the time to talk to somebody, get to the bottom of the root issues, then you can actually do more than just blood tests, but you can actually see what matters to them and what's affecting them. So that's kind of where my interest sparked into, men's health, longevity, and anti-aging
Nice.
and all that. Yeah.